Right away, the left shoulder jumped out to me. Boom.
Boom.
Shabanskis.
It's painful, right? And
It,
then if you are a
but
puzzle master,
look at this.
yeah, draw
Hmm.
an X across our friend's body and with your kind of picture. If you could, you
I
don't have to
can't
leave
draw an
them
X.
there.
I don't
It's
have
okay.
X
But you see what I
capability.
mean? Box him out from his hips to his shoulders. Draw a square and we'll look at the X. All right. Because sometimes people are like, what do you guys look at? What do you guys look at? There's the box. All right. And if we tighten it up, you can see that everything is related. So would you say that the hips and the shoulders are following each other? Sometimes they don't, and sometimes they do. What do you think?
Oh,
Where do you think the
his
impact
right
is?
hip is hiked up.
Yeah.
You can see it over here.
Yeah. And then you noticed immediately his left shoulder, right?
Right.
Correct. I should be careful with that word. So guys, always remember there's cross patterning, right? So open the box up here. Go ahead, Kevin, and open the box up and we can see that same box. Mm. All right.
Wow.
What do you notice?
He's
You can even
got
take it up higher. Let's give him a little more left shoulder.
got a lot of condition too going on, right?
Hey, Chimama. Big time. But let's really open it up on the number on the top. Open his top girdle. Does that make sense?
When
Like,
we
oh
look
yeah.
at his neck. Oh, he's got a shadow here.
Oh yeah. But still, like his left is so much higher than his right, and it starts all the way up. So it's a whole trapezius situational, right? It's not even just like some stringy neck muscles. The whole situation is like up and rotated.
Mm-hmm.
And the ears do, like you call it, the puppy dog. I
Yep.
finally figured out what your puppy dog meant, but it is. It's the body will always find a way to counterbalance. Like that's why we don't fall down.
Right.
A lot of vertigo sometimes happens when people are, they're locked up and their inner ear can't balance.
I see something going on here too.
You do.
Look.
Yes, you do. That's correct. You sure do. He has a lot of protracting slash winging, which is a fancy way of saying that his shoulder stabilizers are weak. His serratus is weak. His mid trapezius is weak. Period. Like static extension position all day long for this person because they're living in their low back. Because if you go below and under what you're highlighting, that is like a freeway system at high traffic. There's just so much congestion, so
Yeah,
much type.
we see a little pocket here that isn't over
That
here.
is that is like a chasm. Whew, what is the? It's too tight, like a girdle.
Yeah, that
Too
could be a
tight.
muscle. It could be some lymph fluid.
It's a very tight lat for
Hmm.
sure. But it's dysfunctional because the serratus isn't doing its job.
Look at the rotation because he's rounded forwards. Look at his hands. I mean, we're seeing his hands practically like they're on a table.
But what I love about him is he's completely consistent, right? So immediately you were like, oh, his left shoulder is high. So his left hand is high. Okay, that's good. Like sometimes weird things happen. You observed that his right hip was high. So if anybody out there actually stood up and did that in their body, they're like, oh yeah, that has to happen. That's how it goes. The problem is when you get stuck,
Right.
you know. So let's look at his side views because his knees are interesting too, but we'll come back to his knees.
Oh yeah. There's so much to talk about here too with it.
But yet he's not that bad off. He's just really rotated.
Now, do
Like
we have
I know
tibia
a guitar
torsion? Do
player.
we
Yeah,
have tibia
let's
torsion or do we have bow leg?
we have a rotation. I wouldn't even try to name it because the knees are so different and we know the hips are so different. He looks like someone who plays a guitar, maybe a bass or something, because he's kind of got that like, laid back thing going on in it. It's an interesting,
Yeah,
I could be so wrong.
you're correct. He is a musician.
No way!
Yeah.
We should make a game show that I could participate in. Yes, you start to see the repetition. He's a musician. Yeah, he would benefit greatly from a program, especially most musicians have a wonderful inside outside connection because the more free he is, the cleaner his music sounds. The
Mhm.
less tension he has in his hands, his wrists, his shoulders, his back, the more stamina, the more breath, the more sound he can communicate with.
Mhm.
It's really funny. I dated a musician for a really long time. So I was like, I know that back. And it's usually, he was a bass player, but he sat back into it for a long time. And it's part of being in the groove, right? I love looking at musicians, working with them, because you can be out of posture if you know how to get back into it, right? That's always what we're talking about. Recovery is health as well.
Right.
We don't want you to not have fun. If you're a guitarist, you're crooked. Period. It's not, there's no way
Yeah.
around this.
It's the body that you bring to the activity.
Yes, I love that expression. Can we get some t-shirts? Body you bring to the, because see, that side's not that bad. In terms of head to foot, the shoulder is a mess.
Yeah, the shoulders.
The shoulder's a mess. But then you're like, that's odd. But again, guitar player has to do this. And that side is a mess.
Yeah.
But we already said there was a massive rotation. So this person, we want to help them stabilize, find center so that they can do their craft again,
Right.
and again, and again, and again. All the stuff that lengthens and untwists will be our friend. And I would really teach this person about their elbows. I would teach everybody about their elbows, but we've got some interesting ways of really communicating with people that your arms come from your back. So when you play an instrument, you need to have that thoracic area really well conditioned. And you can see he's playing from his low back and he's kyphoticking the instrument. We could give him more lift and more tone, and he would be more comfortable. He could play longer for sure. I wonder
His
what kind of,
pelvis seems kind of straight for the most part.
right, because he probably stands when he plays. And then you've got a lot of foot pedals too. So, right, you're playing, you shift left, you pick up your foot, you do your different pedals in front, you go back. Photographers look like this too, because they're always getting around. The right side and the left side, I would love to watch this person play their instrument. And that is something I do with you guys out there too. Because if he really is somebody who can identify like, well, that's my profession, or that's what I do a lot, and I want help with that, we fix that.
Right.
Imagine him doing an air bench and then picking up his guitar.
Right.
It
Yeah.
would just already make an impact because his back's so tight. If we
Balanced
put
right
it
out.
against the
Yeah.
wall, yeah, for sure.
Do you have
Cats
anything
and
where
dogs, cats and dogs, static extension, breathing.
do you have something on your end where we can go inside the
On
body?
my end, to look at this gentleman, sure. Let's try. That's not what
We
I
can get this guy corrected. He looks like he'd be an easy correction. I mean,
people who are younger. I love working on musicians. Okay, here you go. Dun 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 dun. Can you see it?
yeah, the fascia, the crossing.
All right, so this is fascia. If people want to learn more about fascia, you're going to go look up Ida Rolfe. She brought a lot of it to the forefront. Maybe you've heard of structural integration. Maybe you've heard of Rolfing.
Rolfing, yeah.
Rolfing, but Rolfing, Ida Rolfe. There are 10 fascial lines in the body. Anatomy Trains. This is written by Tom Meyerson. Tom Myers. You can look it up. It's a very famous book. You can watch him pull, you don't call them corpses, cadavers apart in lecture if you like. He actually has an online course where he pulls apart the bodies. I think Dr. Reese even has it.
Mm-hmm.
And what it really teaches you is that sometimes where there's no bones, there's a lot of distortions that happen, right? Muscles move bones, fascia connects everything together through ligaments, etc. If you're not sure about fascia, you're opening up some meat and you find that white stuff that's holding the pocket of muscles together. That's the fascia. In a vegetarian world, the orange, all the white between the segments of the orange would be the orange's fascia, but it's a bit of the inner outside container. And when it gets dehydrated, It doesn't function well. It likes to be hydrated, by the way, as you drink. That's kind of well played there, because it doesn't want to get dried out in that sense. Here is how they slide. So when the fascia, like if I put a kink right here, like you guys ever gone on a run and you're like, oh, I have a stitch in that spot right there, but you don't know what it is because there's nothing there. There's a whole stitch in the entire spiral, right? You're like, oh. So the fellow we were just looking at is tight in the back, which means he's loose in the front, right? If I went to the backside, for this X, there's one on the back too, but his is distorted here. That's why you were looking at the windows. Remember, we always talk about these windows. Here are these windows right here. So when we pull
in a slumped posture, we can see also
you see, I
some
love it.
shortening of the spinal line.
Yeah.
I can turn his volume off, but you can watch him move as he goes and then pick up the guitar and play for hours. We need to straighten that up for him, because if I pause it there, look at what it does to the back. You can't do something to the front unless you make it happen in the back. Did you catch it?
Yep.
So if that happens, rhomboid issues, cervical extensors, which is back to between the shoulder blades and up the neck, right? So rhomboid squeeze shoulder blades, middle trapezius work with serratus to set shoulder blades. And that can be a distinction. They both do the same thing, but they do it differently, and they're supposed to do it in a proper order. When they get out of order, we get some chaos, we get tight muscles, we get muscle cramps, we think about like, oh, what's up going on around up here? When the irony is it's probably happening down below. And if we can see this here, there's the back. Yeah, and you can watch it, the rounded shoulders, the head forward position, everything follows. You cannot distort one side without distorting the other side. And that's what's happening for this guy, right? Because he has an off-sided instrument he enjoys. Golfers, rowers, tennis players. Tennis not as bad because at least they shift. But like I worked with the UVA rowing team and I had a gal who did this side. That was her side. She never rowed on this side. And I was like, you need to go practice the other side. And then she came back and she's like, I couldn't even do it.
Yeah.
So if a guitar player, same thing, unless it's a classical and you're doing guitar, Spanish guitar straight up and down. I have a friend who picked up the upright bass because his back became so bad playing, this is the same boyfriend, playing the electric bass. So he took up stand-up bass so that he could keep his posture good and play it because he didn't want to give up being a musician. But he couldn't do it anymore because he had waited 50 years to finally go, I think my back hurts. He should have said something sooner. And you can just see if so again, we look at the front, we look at the back. This is us. This is our posture line. And just think about that, guys. The right side of your neck, left shoulder. That makes sense. Hence, when you say, oh, shoulder up, puppy ears, right? There's a cross pattern. And then it goes under your armpit and across your ribs where you get that stitch when you're running. And that whole thing is right? You just don't use muscles in a vacuum. They all go together, one at a time, all together now. It's like a Beatles thing, right? So I'm going to turn this off and give you back that screen. Yeah. So if you look at that gentleman and you really start feeling how fascia, right? We talk a lot about muscles, but we have to also talk about fascia because sometimes people's muscles are great, but their fascia is really tight. So some of the stuff we give in protocols, they'll have a really long hold. That's for the fascia, guys. The fascia needs a little bit more time to slide. It slides. It doesn't stretch. It slides. Yeah. And if it doesn't slide, it's stuck, dehydrated, in a crunchy. That's not very like technically termed, but it's like that. So this gentleman, I think, has got a lot going on in that low back. And then the fascia out of that low back is in distress.
Well, yeah, because he's not overweight.
Nope.
But yet he's got
That is
Lo-
a great observation. Yes, but he carries a guitar in the like the belly.
Yeah.
That's a really interesting observation from the weight perspective.
Yep.
Because it's true, if you're carrying weight in the front, yeah, your back muscles are working more. Ask any pregnant woman.
All right. Well, he needs
I
a
would
little.
love, yeah, I would love to work with him. You can almost see the front belly is like kind of, it's tight but droopy,
Right.
right? Under the rib cage, there's a bit of tone, but below the belly button, actually, he's not toned. He's not fat, so you can't call it, but that's because his back is real tight.
Yeah.
So it's an abdominal wall that's weak. We just don't identify it because a lot of us in cultures are like, oh, but it's flat. We call
Dynamic
these
tension
people
going on.
fat skinny. They're the fat skinny because that he's actually got too much. He doesn't have enough tone going on. I'd like to see his shoulders a little stronger, his thoracic a little stronger, so his forearms and his carpals and stuff could get some relaxation.
Yeah.
Yeah, for sure. I would love to work with a musician. I think it would be amazing. I love working with musicians. I do because they care. If you've ever gone somewhere and listened to something and you've seen or listened, and then a person like plays with how they're doing it, and all of a sudden the resonating is so much better, the body's the same way. You
Right.
know, when we're postures better, we get better sounds.
All right. Well,
All right.
if anyone else out there wants a P-Ray, go to peaceoverpain.com. We don't charge for these. And it's a
Sure.
great way to see what's going on with your specific body.